Progestin-only contraceptive methods are very popular in the United States. Commonly used methods include the injectable high-dose progestin contraceptive, the depo-medroxyprogesterone acetate, the intermediate-dose implantable contraceptive, Implanon, the progestin-releasing IUD, Mirena, and progestin-only pills. Progestin-only contraception is popular because of its excellent efficacy and use for women who cannot use estrogen-containing contraceptives, such as women with a history of blood clots or who are breastfeeding. The progestin-only contraceptives are not all alike. Depo is a high dose of progestin and inhibits ovulation in most women, whereas progestin-only pills only inhibit ovulation in about half of women. Implanon also inhibits ovulation in most women. The Mirena IUD works mostly locally by causing endometrial atrophy and has minimal effects on ovulation. Because many women on these methods are non-ovulatory, they are at risk of having irregular bleeding, which is the most common side effect of progestin-only contraceptives. Abnormal bleeding in a woman on a progestin-only contraceptive is usually caused by endometrial atrophy. However, a full evaluation is necessary to exclude other pathology. Any woman coming in with abnormal bleeding should have an HCG, consideration of a TSH, evaluation for systemic disease, and evaluation for a possible structural lesion or sexually transmitted infection. Common structural lesions that can cause abnormal bleeding include uterine fibroids and endometrial polyps. Evaluation should consist of an assessment of adherence, an HCG, consideration of an H&H, especially if the bleeding has been heavy, a TSH, prolactin, and testing for sexually transmitted infections. If clinically indicated, a pelvic ultrasound looking for fibroids or other pathology can be useful. In women over 35, or women who have a significant change in their bleeding pattern or heavy bleeding, an endometrial biopsy can exclude endometrial hyperplasia or malignancy. The initial treatment of most women who have abnormal bleeding while on a progestin-only contraceptive is supportive, with education about the mechanism of bleeding. High-dose nonsteroidal anti-inflammatory medications, such as 800 milligrams TID of ibuprofen, can decrease the amount of bleeding. Because the mechanism of abnormal bleeding is most likely to be endometrial atrophy, adding a low dose of estrogen supplementation can be helpful. Some clinicians use an estrogen patch. Oral estrogens can also be used, including estradiol or conjugated equine estrogens. If all else fails, cycling a woman with a few cycles of oral contraceptive pills may also be helpful.